Hello, everybody, and my name is Dr. Lynn Klima, and I'm going to be your presenter for today. Today, we're going to be talking about team based care and interdisciplinary team communication to promote patient safety. So, we're going to review the concept of team based care and the roles contributing to the patient's plan of care. And we'll discuss the importance of effective team communication to promote patient safety. The content is going to include evidence based communication strategies that are used across teams that assist with effective communication. There are no disclosures that we have to make for this course. The content is researched and written by an in house team of registered nurses. QAPIplus or the presenter do not have any financial interest, relationships, or other potential conflicts with respect to the material, which will be covered in this presentation. My name is Dr. Lynn Klima. I'm a nurse practitioner with over 40 years of experience in acute primary care and community based settings. I'm also faculty at the University of Olivet, and I serve as the patient safety officer for QAPI Plus PSO. The objectives today are to discuss approaches to effective team based care, talk about SBAR communication model, and identify the components and their purpose for enhancing communication in healthcare settings. Talk about common barriers to effective communication in home care and hospice settings and propose strategies to overcome these barriers to ensure clear and compassionate interactions with patients, families, and team members. Apply that SBAR and really learning how to use it in clinical practice. All right, so team based care, let's start with the definition of this. This is the provision of health services to individuals, families, and or their communities by at least two healthcare providers who work collaboratively with patients and their caregivers to the extent preferred by each patient to accomplish shared goals within and across settings to achieve coordinated, high quality care. This is a video, and this is an overview of team based care. You can find the link for this in your materials for this session. There's actually three videos, and this is one video clip that is available for you to watch. All right, so let's think about who are all those folks that are on a team and why it's important to think about all the community team members as we're getting started with thinking about the patients that we're going to be caring for. So, in the home care and hospice setting, obviously our patients are not in a facility necessarily, right? So, they're either in an independent living facility, they're in their home, they may be living with a family member, and so when we think about the team, we want to first of all make sure that we are thinking about the patient as a member of that team. They are core to that. And then within that team is their medical home. So their medical home would be considered the practice where they're going to receive their primary care services. So like their general doctor and the staff that are within that home, so or within that medical home. So that could be the provider, the nurse practitioner, physician assistant, reception staff, medical assistants, maybe they have a social worker, maybe they have access to a pharmacist, maybe they have a dietitian, maybe they have a community health worker. So every medical home, every patient should be assigned to a medical home. That's their primary place where they receive their health care. And then their medical neighborhood are those folks that are outside of that medical home that provide services to that particular patient as well. So it might be their acute care hospital, it might be the home care agency that is supporting them by providing services. It might be palliative care, could be their specialty providers, like if they see cardiology or GI, so thinking about that medical neighborhood and then the community. Where are all those other community resources that they might be benefiting from? So when we think about team as we're going through this presentation, I really want you to think about team in the broadest contents, right? Context. All of these different people that are going to interface and support that patient who really is the head of that team. When we're thinking about effective communication, one of the things that we want to think about are barriers right from the get-go, right? So again, I'm just going to be outlining these for you to think about What are some barriers and how they might impact our ability to be fully present and engaged to work with each other, right? We're not really specifically talking about patients in this conversation, but how we work together to support the patient. And some barriers might be personal, right? So maybe we have memory limitations. Maybe we are stressed or anxious for any number of reasons. Maybe we're tired. We have physical factors that might be impacting our ability to be present. We're multitasking, right? So a lot of us in healthcare do a lot of multitasking. We might have flawed assumptions in terms of what other people's roles are, what they should or could be doing or did or didn't do. And that could be creating a barrier for us. And for many of us, it might be that we're new, right? We might be in a new role, a new organization, have a new focus in our work. Maybe we're just new to a specific team. So a lot of those factors play into how people communicate with each other, right? Those personal things that can maybe get in the way of people being fully present and accepting of each other. Other is environmental. When you think about healthcare and where we're working, there's many modes of communication. We're going to talk about some of those. Rapid changes, time pressure, distractions, interruptions, and even variations in team culture from member to member, from provider to provider. Everybody kind of works and acts together differently. And so there are some things that definitely are, could get in the way, right? And so, one of the things that this just tells us is that we need to think about how we have clear, concise methods for effective communication, how we can be more present by being more focused and organized in the way that we're going to be talking to each other, and also being proactive about identifying who are those team members and how should I could be communicating with them, and then who are those members of the team that I should be working with to support the patient, and what are those processes that we use within our organization to assure that we're communicating with the patient, people within our own organization, team members in that medical neighborhood, in that medical home. Who and how do we do that? What is our approach within our existing organization? So be thinking about this as we kind of launch into this session. So when we think about effective communication and what the literature tells us is one, it's clear and concise. We want to communicate information in a straightforward and easy to understand manner, avoiding unnecessary complexity or jargon. Listening. We want to actively listen to the audience, whoever we're talking to, seeking to understand their perspective and respond appropriately. So we're listening, not listening to respond, but listening to hear what they have to say. Our communication should be tailored to the audience. So you want to adapt the communication style and content to the specific needs and preferences of who you're communicating with, right? So if you're talking to a specialist, you might be having a conversation completely different than how you would approach maybe a caregiver that's working in a patient's home, or maybe with their spiritual advisor. You're going to tailor your communication based on the role of the person that you're going to be talking with. And then feedback. We want to make sure that we're encouraging feedback and confirmation to ensure the message is received and understood as intended, right? So that feedback loop. What I said, was it received? Was it understood? So that the person on the other end knows how to respond and knows how to act on it. And then we know that it was taken care of, right? So closing the loop with that communication. So effective communication is a crucial skill that enables clear and meaningful exchange of information, leading to better understanding, collaboration, and achievement of goals. This is a quote by Peter Drucker. The most important thing in communication is hearing what isn't said. So it's not just about the words, it's also about the message and the intention behind the message and being able to figure out what it is. All right, so just again, just as a recap, we're thinking about communication and how we communicate with folks in teams or across teams. And so these are just some examples of some different folks that maybe you would be communicating with. Maybe it's your manager, operations manager. Maybe it's a case manager. Maybe it's the home health aide. Maybe it's the social worker. Maybe it's the primary care provider. Maybe it's all of these people, right? So when we think about our work on a day to day basis, communication is core to what we're doing, what we're reading, what we're taking in, how that information is shared with us, how we're acting on it, how we're letting others know what happened in that encounter, and what the patient's preferences are, what we're learning from the patient and their family. So communication has to be right, right? It's core to what we're doing. So one of the things that's really important as we're getting started or you're getting started to think about how you best work with team members, it's really about building those relationships. Just like when we work with our patients and their families, having a relationship with those members on the team in your organization and in that medical neighborhood and community are also opportunities to improve our communication and our communication style. So when we think about relationship building, one of the very first things that you should do in terms of putting the responsibility on yourself is to really look for opportunities for interactions, right? We're in a digital age now, and everybody's really quick to text, tiger text, instant message, send an email, but really look for opportunities to have interactions with each other. How can I talk to somebody? Can I stop in the practice? Can I do a co-visit? Can we be in the office at the same time? Can we, even, get on a virtual call but be face to face in that virtual call so that we can see each other? You want to look for those opportunities so that you can directly interact with people and get to know more about them, their style, what they do, what their role entails. If you're new in your job, it's really good to be able to go and do some job shadowing to see what everybody else's role is and be curious, right? Recognizing that we come and we all have common goals and values around the work that we're doing for the patients that we're caring for, and how we communicate with each other is going to be different, right? And so respecting and acknowledging those differences in communication style and being able to assume the best, right? So again, we're all there for common goals in terms of caring for the patient, and so we want to recognize and assume that people are doing their best in their job, right? Even though things aren't always going to go perfectly, we want to, have that assumption that people are trying and they're doing the best that they can. And then seek to understand, right? So if there's something you don't understand or something that's getting missed, we want to be able to be direct and, try to address issues proactively so that we can continue that positive communication with each other and not get into a negative space in terms of things that might be frustrating us or that we didn't understand or didn't know, or didn't assume the best in the person that was, doing the work on the other side. So, really, one of the hallmarks of communication is developing those relationships with folks internal to your team and external to your team so that you get to know more about them, how they communicate, and what their work is. One area of communication is nonverbal, right? And we don't often really talk a lot about this, but nonverbal communication plays a crucial role in how we convey and interpret messages. So, our body language, our tone of voice, and facial expressions can either enhance or undermine the effectiveness of our communication. And these nonverbal cues can provide valuable insights into an individual's emotions, intentions, and levels of engagement. So, again, thinking about how we communicate with each other now, it's not always face to face. So, we don't always have the benefit of seeing that whole person or all their nonverbals, right? So, you might hear a tone in somebody's voice, or you might read a tone in somebody's message that they sent to you, and you're not really circling back around necessarily to understand it, or you might be misreading it, misunderstanding it, right? And so recognizing that part of communication are those nonverbal things that we don't always have the benefit anymore of seeing unless you're working directly with folks within, a practice or an organization on a routine basis. You aren't necessarily going to have the benefit of seeing all those nonverbals. You might just hear a tone or read a tone in some of the digital communications that we have. So that can also make or break, right? What's happening with our relationships with folks. Another part of communicating is we talked about listening, right? So what it's called is active listening. So we're listening for what the intention of that speaker is. And so when we're listening, we want to have the ability to make direct eye contact with that person, avoid any distractions if at all possible. So if you're on the phone with somebody or on a virtual visit or talking with them in a clinic or in a professional space, you don't want to be looking down at your phone or on your device doing something else. You really want to focus on the speaker so that you're giving them their full attention. And then try to avoid interruptions, right? So while that person's speaking, you want to refrain from interrupting them, let them finish their train of thought, and let them, ask if they're finished so that you can know whether you can step in or not, but don't interrupt. Let them finish. Paraphrase and summarizing. So this is really the active part of that listening is that you're listening to pull out those main points and reiterating them back in your own words to ensure you've understood their message. Demonstrating empathy, right? So you want to also use what they call nonverbal cues and leads, like nodding, smiling, or using other nonverbal cues to be able to indicate that you're listening and that you're interested, and ask clarifying questions. If there's something unclear, ask the speaker to give you additional details or explanations. So again, when we're working with our peers, that active listening, and has to be really intentional because we're always busy, we're always multitasking, doing a lot of different things. So be present, make eye contact, be fully focused, don't be distracted, ask clarifying questions, and pull out those things that you're saying and ask to say, did I capture everything? Is there anything else that you intended to tell me that I missed in all of that, right? We want to be able to capture that. In the digital age, right? So a lot of us now are in this space where we're doing more video conferencing, we're communicating on social media platforms, instant messaging, email communication, portal documents that are sent through the cloud. I mean, there's just in this endless way of sharing information with each other, and we have to be aware of that, right? So where or how, what are the expectations of what are those messages and how are they sent over? If you're following with a patient and you're out in the field, how are you communicating? Are you picking up the phone and calling? Are you just documenting in the patient's record? Are you sending a text through a group text messaging? What are those mechanisms that you're required to use, and how are those things used, right? And so not all platforms make sense for all communications, right? You want to be able to use the digital technology in the space that it's meant to, right? So if you have something that's really urgent that's coming up, you're not necessarily going to just send an email. You're going to make sure that you're communicating directly and following through whatever your organizational policies are and what is the best method to be able to use the digital platforms and for what reason, right? How are we doing this? So we know that, there's those formal communication tools, documentation, and the electronic medical record is one location where we're, communicating what we've observed or heard from the patient and their family, what's happening in their plan of care, and then what are those changes and goals and, any pieces of information that we want to make sure that is documented in the record is a formal communication method. Other teams might do stand up rounds. I've worked with groups that do stand ups every day, just with all the team. Usually they're virtual, or maybe they might be in the office and everybody meets in the office first and then disperses on their day, just to kind of give an overview of what's happening, who's where, what needs might come up, who's available for visits, if visits or admissions need to come up. So stand ups are really an important real time opportunity to communicate. In a primary care practice, that might be something called a huddle, right? Like if you're out looking at what the day is going to look like in the clinic or the clinic session. IDTs, so interdisciplinary team meetings, so those meetings that take place for your teams that include all those disciplines, the provider is there, and that's a formal way to be able to review patients' cases and needs. Other ways that folks might formally communicate with you are through your organization's policies and procedures and written agreements, or staff meetings or team meetings. Those are other formal ways. So every type of communication has a different kind of an intention. Informal messaging might be Skype or Teams or Tiger Text. There might be ad hoc conversations, and there might be phone conversations. I should also add in here portal. So there might be things off of the device that goes to through a patient portal as well for communication. So it's going to depend on your organization, what you have available to you, but recognizing there are ways that we communicate with each other formally to give the clinical perspective of what's happening with the patient and how we communicate with our team members and what our policies tell us what to do or our procedures what to do. They give that framework, they communicate the steps. And then informal, how do we dialogue with each other around what's happening and keep each other abreast as to what's needed for those patients. So we talked about operating guidelines. You also might have standing orders, admission orders, um, transfer orders, hospitalization orders. So, whatever policies that you have around these things are important to know as a part of your orientation and learning in your um, in your field. Another type of a formal communication process that you may be familiar with is called a collaborative practice agreement. And this is a legal agreement that formally defines the relationship between a physician and care team members. Usually, you'll see that within an organization if you're contracting maybe with pharmacists or dietitians, and that gives them an expanded role as a care team member beyond the normal licensure confines. And for pharmacists, this frequently gives them the ability to provide medication management through titration of medications and ordering supplies. So, depending on what resources your organization has, you may have some collaborative practice agreements in place with some disciplines to be able to support and broaden the type of support your teams can provide to patients based on their plan of care. So we talked about standing orders. So again, whatever kind of standing orders you have within your organization to help drive the work, these are things that you know that you can do that should be included in this kind of a visit. Maybe you're starting a pain pack. Whatever those standing orders are, they're going to communicate formally what is what you're able to do within the scope of your role. We also talked about different kinds of meeting examples, and these are going to also vary within your organization. So, stand ups or huddles or the IDTs, or then formal meetings like agendas, your staff meetings that have agendas, maybe your provider meetings, your all staff meetings. So, there's a lot of different ways that within an organization you're communicating or being communicated to around what needs to take take place. So the business or the flow of the day are examples of some of these things that you might see in practice. All right, so let's also talk about just how communication is so important within the care that we're providing, not only with our patients and their families, but also with each other. We know that we work in complex settings, right? Healthcare is very complicated. It doesn't really matter what line of business you work in healthcare. Healthcare systems are complicated. There's so many different services, providers, locations, just very complicated. And our patients are more complex, right? As of 2020, we know that least every adult patient, 50% of the adult patient population has at least one chronic condition. And based on where we're working, patients don't just have one chronic condition. We're seeing patients with multiple complex conditions that need support to be able to help them manage the day to day and to stay and maximize their health as best we can. And when we think about communication, it's often taken for granted as something that we do. And, we only really recognize when, maybe something has gone poorly or didn't go as expected, or we didn't achieve the outcome that we were expecting to say, oh, let's look back. We should have, we could have, we maybe didn't do this, or we didn't document this, or I didn't know. So communication is core. And when you look at there are two agencies that are out there that do a lot of research around best practices. One is the Institute for Health Improvement, so IHI, and the other is the Agency for Healthcare Research and Quality, AHRQ. And a lot of their work is creating resources and tools that are evidence based to help support care teams wherever they're practicing. So when you look at the data that they have out there, they tell us, communication is one of those key strategies, how we communicate and with whom we communicate, that are going to not only improve the patient experience but also help us deliver the safest care possible. So, something that we, just kind of take for granted is very important in terms of our supporting our patients. So, we know there are challenges, right? So, how we communicate and the different ways that we communicate is clearly an issue. Um, when you look at the information that's out there, we all have different work styles, preferences, different locations. And so just recognizing the complexity in how we communicate is important in terms of thinking about how we could do it better. Where can we do it better? We think about where we work, right, home care and hospice, we have even additional challenges, just that geography, where we are in relationship to where the rest of our team is, and how do we, connect together. We have a lot of diversity in our team, right? We have a number of different professionals. Clinical staff, licensed staff, unlicensed staff, volunteers, patients, caregivers in the home. So just a lot of different people that we're dealing with, and so that in and of itself is also challenging. Language and cultural barriers, right? So when you think about maybe our team members, maybe the communities we work in, maybe the patients and their families. So again, that's an area that is can create additional challenges. Emotional sensitivity, so, especially if you're thinking about, palliative care and hospice care, and you're having to have those conversations around end of life care, and these are really sensitive topics that are really hard to, for patients and families to have, and whether they're ready or not ready, um, to have them, it can, really be an important focus for how we support them and give them the time that they need, but also emotionally draining for us as well, right? So there's that two-way, uh, two-way assessment, right? What or how do we best communicate with those family, but then also how do we support each other on the team when we are having these conversations with our patients around end of life. The intensity and the emotion runs high in those experiences, and then our technology in terms of our limitations. So again, if you're out in the field, you might have good access to internet, maybe not, maybe Wi-Fi is a problem. Secure messaging might be challenging. So there's a lot of these other things that kind of play into our ability to be effective at communication with each other. So those are just kind of some overview highlights of things to think about in terms of challenges for communication, recognizing that communication is front and center. It's the hallmark of good patient care, solid patient care, and we have to be intentional about avoiding those distractions, being aware of what they are, and trying to move forward with the best approaches to communicate with our team members as we can. Now, this is a video that is also in your training materials for this week, and this is a YouTube video also on SBAR, right? So we're going to spend a few minutes talking about SBAR, which is an example of a evidence-based framework for communicating with team members. And we'll talk about the acronym SBAR, but if you could take a minute to watch this bad example of communication with a team member. So as you can see, if you had a chance to look at that video, you can see that the provider was busy, not necessarily focused on hearing what the pharmacist's recommendations had to be. And the pharmacist wasn't prepared to have that conversation in a way that had all that information available to be able to make that time the valuable time productive with that provider. So, one of the strategies that's out there that is encouraged to be part of our clinical practice is to use the SBAR framework to be able to have a standard way that we can effectively exchange critical patient information and make informed decisions to improve patient outcomes. So, SBAR stands for situation. So, S describing the current condition, excuse me, or the state of the patient. The background provides relevant history and context about the patient's condition. So B is background. A is assessment. It outlines the healthcare provider's analysis and interpretation of the patient's status. So what are you seeing and what's your interpretation of that? And then your recommendations. What are the next steps? What do you think needs to take place? Now, by providing a consistent framework, it enhances how that information flows between healthcare professionals and making sure that we get the important details out about a patient's condition, treatment plan, and recommended actions. And we're trying to do it in the most concise way possible. Right. And so, if the more of us that use the standard, the more of us are going to get more comfortable with that particular framework. And this isn't anything that's totally new, right? It is just, again, a reminder to all of us that when we're going to be interacting with folks, taking the time to be prepared and to put an SBAR together so that we can have a solid, articulate, concise conversation about what's happening and what we need and what we recommend those next steps to be. Otherwise, we're telling this whole story, convoluted story. And as you know, our patients have a lot of things going on with it, right? And so trying to just sort of pull through everything that we've seen, assessed, we've been told, and putting it together in an organized way will help us communicate effectively so we're getting the right information across and not missing out on anything. So we talked about that. It's valuable. It's a standardized approach. It's based on the evidence, and it is, an easy process. So what I encourage you to do, I have a tool sheet in here, is to just have that acronym SBAR listed so that you just get in the habit of saying, this is the situation, this is the background, this is my assessment, this is what I'm recommending, and that helps you kind of get through all that information. So when you look at the literature, the reasons to do SBAR or to incorporate SBAR into your communication is that it reduces errors. It by having a standardized format for communicating critical information, it helps us make sure that we're covering all those important details and we're not overlooking anything. So that reduces our risk of miscommunication. That ultimately enhances patient safety, right? So by promoting concise and focused communication, it helps healthcare professionals identify and address potential patient safety issues in a timely manner and ultimately improve those patient outcomes. It improves team collaboration, so it facilitates that clear and structured communication, enabling our members of our team to work together more effectively and make informed decisions for patient care. And it should improve patient outcomes, more accurate diagnoses, timely interventions, and better overall patient care, resulting in improved clinical outcomes. So this is the resource for the HRQ government site, and this is an example where, in this situation, they're explaining what's happening with the patient. Dr. Liu, this is Alex, a nurse from our Fifth Street office. I'm calling about your patient, Mr. Webb. He reports being in substantial discomfort and that there is not much urine in his catheter bag. So you're giving the situation. Do not forget to introduce yourself, right? So your name, where you're calling from, what your role is, very important. In this scenario, the background is what is the clinical background or context? Mr. Webb is an 83-year-old patient that has a catheter in place during his recovery from bladder cancer treatment. Assessment. What do you think the problem is? He also reports a temperature of 100.4 and that the urine in his bag is cloudy and slightly red. I'm concerned he may have an infection and that his catheter may be clogged. in your recommendation or request, what would you do to correct it? I would like him to come to the office this morning for you to see him. When he arrives, would you like us to get labs, including blood cultures, to check for infection? So adding that request in there. A lot of times people are uncomfortable with that R. Again, being able to just tell that provider what you think you need in the next step, right? Would you consider adding, another pain, modifying his pain medication, having him be seen by his primary care provider? Just what it is you want generally, so you're going to be able to go ahead and make that recommendation. So, and providers tell us they appreciate that. They want that level of um, information so that they can then think about, okay, yeah, that makes sense, and let's add this or let's do this. So they want to know the direction of the call. As far as adaptable, you can use different parts of it, picking and choose depending on what's happening with your team. You want to determine which parts are relevant when communicating, so all members of your team can give you that SBAR format. You can also teach your patients or their family members to use SBAR too, like what's your situation, what's happening, what would you like, the recommendation, what asking from the provider what it is that they need from them. So it's actually kind of a nice way to do it. And again, they recommend, using the words situation, background, this is the assessment, this is my recommendation. So you get into the habit of putting it all together. And some of that might mean that you have to do a little bit of legwork, right? You might have to find maybe some lab values or, some dates on, visits or testing that maybe have done. You have to put your information together so that you can have a solid SBAR. Now, this isn't, like a 40-page communication. It's again meant to be as concise as possible for what it is that you're needing. So it is, a good way to help teams communicate critical information in a clear way. When they look at data, HRQ and IHI, they look at some of the things that help by using the SBAR. Readmission rates, symptom management, satisfaction, and adherence, right? So patients are more likely to adhere to a treatment plan if they understand, what's going on and follow through and based on what we've communicated to the across the team and shared that information with each other, they're happier, right? So then they don't have to report those errors. Symptoms are addressed more timely, and we can prevent some readmissions. So again, we know that the benefits are it reduces communication errors, it enhances patient safety, and it improves team collaboration. So this is, again, just that SBAR situation, background, assessment, and recommendation. So when you think about do you use it within your organization or at your in your own clinical practice, if you're a leader in that organization, how are your teams using it? Do they use it? Is your organization ready to take on something that is more standardized, right? So evaluating that organization's culture, your processes, and your resources to determine the level of readiness for implementing, and any potential barriers or facilitators. What would be the things that would help champion and propel the use of it forward, right? Sometimes it's just the culture, right? Having this expectation that we're going to use a structure that is evidence based to communicate, and then having an implementation plan. When are we going to do this? How are we going to train staff in doing it? How are we going to maybe practice doing it, and then have training on it? And then thinking about, how you can support if you happen to be a manager in that space, and then implementing SBAR, to making sure that it becomes a standard of practice, right? So this isn't just something that's encouraged as individuals to use in their practice, but as an organization, taking the leap of faith to be able to champion a structure or a framework that is evidence based, that's going to help you overall improve satisfaction, team communication, and ultimately clinical outcomes by reducing, some of those errors that take place based on communication issues. So here's a couple of examples, right, in a healthcare team space. So this is a group of people, including nurses, doctors, and pharmacists, gathered to discuss a patient. So here, like in those team rounds, this could be like an IDT meeting. How can you use SBAR within that IDT team to be able to communicate with each other what's happening? Do you have any documentation tools for yourself or for your team members to be able to write those communications down when you're giving, report or reporting out using it? I find it's very helpful to have that information in writing when I'm gonna, get more confident in using it. Chart review, maybe you're pulling some information out of the chart to be able to add to that SBAR worksheet and then again communicating with each other in a collaborative discussion, case conference, IDT, those kinds of things. So there's lots of ways that you're going to be able to use the SBAR within your organizations, but then also how you collect information for the SBAR could be from those team members, will be from the chart, could be part of those discussions, right? So when you're thinking about building your SBAR, but then also communicating and using it with each other, how do you kind of, collectively start to use that approach and then get information from each other to build into it? This is the third video that's in your resource materials, and this is effective communication. So it's the exact same scenario that you watched earlier. They spend the same amount of time in their interaction with each other, but you can clearly see that that the second version is done more effectively, and the provider and the pharmacist both get what they need for a variety of reasons, right? The pharmacist is more prepared, he's more confident, he knows exactly what he's telling the provider. He asks permission if she has a minute to be able to discuss a case, and they come up with a recommendation together. It is clearly something that is easy to use. It just takes a little bit of practice to get it down into a concise and efficient way. So when you look at those videos, think about what made the difference between the good example and the not so good example. All right, so here's an example for us. We're nurses and we're working in a home care setting, and we're responsible for a patient named Mrs. Thompson, an 82-year-old woman with advanced heart failure. During our visit, you notice that she exhibits increased shortness of breath and has not been taking her medications regularly uh, due to confusion. That's Mrs. Thompson. She's 82, advanced heart failure with symptoms. So let's think about the situation, the background, the assessment, and the recommendation. So take a minute and write down Mrs. Thompson's situation, the background, your assessment, and your recommendation. All right. So let's go through the situation. Hello, Dr. Smith. My name is Lynn Klima. I'm the nurse practitioner here in doing a home visit, and I am calling to report that Mrs. Thompson, an 82-year-old patient of yours with advanced heart failure, is experiencing increased shortness of breath. During my visit today, her oxygen saturation was at 88%, and she appears to be in respiratory distress. So I'm giving my introduction of who I am. I should also say what my agency is, and that I'm just visiting her today at the home, and this is what's happening. Little bit of the background, right? Because these docs have a lot of patients. So just to remind you, Mrs. Thompson has a history of heart failure and has been on a diuretic regimen to manage her symptoms. She also demonstrated some cognitive decline, which has affected her adherence to her medication schedule. Her recent appointments showed slight weight gain due to fluid retention, and the family has expressed concern about her health status. So you're kind of filling in the blanks a little bit more. What's the bigger picture that's going on here? Oops, we already did situation. Um, my assessment, based on my assessment, Mrs. Thompson is in distress and has signs of fluid overload, possibly due to missed doses of her diuretics. Her vital signs are unstable. Her pulse is 120 beats per minute, and she has a mild cough producing occasional pink sputum. This may indicate worsening heart failure. I recommend that the physician considers adjusting her diuretic prescription to address her fluid retention and assess her need for hospitalization given the severity of her respiratory distress. Additionally, I suggest arranging for adding a home health aide to assist her with medication management and provide family education on signs of worsening symptoms. So, again, in terms of a recommendation, you might say, if you're not comfortable with her diuretic, saying something about her medications, you could say, I recommend that somebody needs to look at her medication schedule to see if there's anything else we can do differently with her meds. Maybe you need to have her seen in the office today, or would you recommend sending her to the emergency room? So, and then asking for some additional support later. So again, what are those immediate things? If you're seeing that patient and you feel like they need to be seen right away based on that breathing, you want to be able to, say that, right? Like this is something that needs to be addressed right away. So after presenting the SBAR report and getting those orders from the physician, you want to make sure that you're documenting the communication and the actions that were taken and then provide any updates to any changes in the medical record that need to take place, whether it's her med profile or and then the assessment templates or your care plan, depending on what's happening. So one of the things I encourage you to do as we talk about this, today is where are you going to start? So depending on what your role is in the practice, starting to come up with developing a plan for ongoing, goals to improve your skills, resources you'll need to accomplish them, and how will you know that you've achieved it, right? It just kind of takes practice to get started to use it, and it will definitely help with your communication with your team members. So, some key takeaways are the importance of SBAR. We know that it's a streamlined, evidence based tool or framework that can be used in healthcare settings. Part of our communication is we want to make sure that we're using active listening to be engaged with each other. We want to communicate in a clear and simple way. We want to recognize any barriers, whether they're personal or environmental, things that are kind of getting in our way that might be giving us having complications to being good communicators or having effective communication. Practice makes perfect, so role playing and using that SBAR is a great way to build your confidence in using it. Effective communication is a continuous learning process, right? So it's always about getting better. So look for ongoing education, seeking feedback, having somebody observe how you communicate, and asking for feedback that takes a little bit of, you know, being humble, but it is possible, to just want to get better, right? So asking for that review, maybe that's something that you ask for on a supervisory visit that somebody can look at in terms of how you're communicating. Strong communication with team members enhances care coordination and improves the overall patient outcomes. We have a shared understanding of the patient care plan, and we know what we need to do to work together to help improve that patient's care. And then that documentation and follow up. What are we going to be doing? Who's responsible for it, and how do we make sure that we're doing it? So, if we integrate these key takeaways as healthcare professionals, we know we can significantly improve the quality of care provided to our patients, both in the home and hospice setting, that will lead to better outcomes and enhanced team dynamics. There are some resources for you, as well as the resources in your assignment page for this assignment. All right, everybody, thank you and have a great rest of your day.